My name is Becca, and I'm going to talk about perfluorine and PFCs, also known as liquid ventilation. So first off, what are PFCs? PFCs is the abbreviation for perfluorocarbon, and these are a type of hydrocarbons where the hydrogens have all been replaced with fluorine. There's an example of one here on the right, which is called perfluoron. Perfluoron is the one that's used the most often. It was developed in the 1940s when we were trying to figure out what to do with the poison gas that was being used in World War II. And it's really special because it's a liquid, but it can hold very high amounts of oxygen. So how do PFCs work and why do they matter? Because perfluorine can hold such high amounts of oxygen, animals that typically breathe air are actually able to breathe this liquid. To understand this, I have a clip from the 1989 science fiction film, The Abyss, which does a good job demonstrating how this works with a rat.
Can I borrow your rat? What are you doing? Hey, no. You're gonna kill her! It's okay, I've done this myself. Oh man, what are you just drowning her? It's gonna be fine. I breathed this myself. It's gonna be fine. No man, she's gonna drown. Look, she's freaking out. She's going through a normal adjustment period. Normal? Does this look normal to you? She's gonna drown. He's taking the fluid into his lungs. He's taking the fluid into his lungs. There he goes. There's a bit of anxiety here. He's starting to relax. He's breathing fine. See his chest moving? Getting plenty of oxygen.
Now, this is from a science fiction film, but this was really done in the filming. They actually did submerge a live rat in perfluorocarbon, and as you just saw, the rat was able to breathe the liquid just fine. So what are the applications of this? In the film, this was being used for diving. Because this is a liquid, it doesn't have the helium or nitrogen toxicity problems that are associated with decompression sickness. Theoretically, this could also be used in space travel. If astronauts could breathe liquid, the G-forces on their bodies would be better distributed, and they wouldn't be as affected. These applications are both theoretical, but more importantly, it's actually being used today in medical settings, specifically in 3 areas, with pediatrics and premature infants, in cardiac arrest patients, and in patients with debris in the lungs. So this animation on the right shows how it's used in cardiac arrest patients and why. When a patient goes into cardiac arrest, you're trying to minimize the amount of damage to the brain, and that can be done by inducing what's called therapeutic hypothermia, or cooling the body really quickly. Previously, methods used for this were to put the patient in an ice bath or wrap them in cooling blankets, but studies have now shown that liquid ventilation is nearly 2 times faster than those methods. Wrapping someone in ice can lower the body temperature by about 1.3 degrees Celsius in an hour, whereas liquid ventilation can drop the temperature an average of 2.3 degrees Celsius an hour, sometimes as quickly as the first degree in the first 15 minutes. That's done by the perfluorine being cooled and pumped into the lungs, and then as the blood circulates through the lungs, it's cooled before it circulates through the body. Best of all, it's minimally invasive and it doesn't require much equipment. Another way that this is used is in pediatric care, particularly with premature infants. When infants are premature, their underdeveloped lungs aren't necessarily producing surfactant, which is the stuff that keeps the lungs from collapsing on themselves. These babies are used to breathing liquid because that's what they were doing in the womb, and filling their lungs with a liquid that allows them to breathe can actually reduce the stress in their lungs. Here on the left, we have an X-ray of a child whose lungs are full of perfluorine. As you can see, it shows up as just bright white on the X-ray. The other thing this can be used for is removing debris from the lungs. When you fill up the lungs with liquid, anything that's in there, smoke particles, dust, mucus, kind of loosens up and it can be drained out. And this is really useful because there aren't easy ways to remove it otherwise. So why is this not more widely used? There are some complications. Here on the right is a picture of illusionist David Blaine, who in 2008 broke the world record for holding his breath for the longest period of time. He did a TED Talk about this where he talked about trying to use perfluorine as part of this stunt and described it as trying to breathe with an elephant sitting on your chest. This is the main complication with perfluorine. It's really viscous. It's harder for the lungs to breathe out liquid than air, and it takes a lot more pressure to force it in and out. So the main issue is that it's really oxygen rich, it's great at gas diffusion and exchange, it can lead to respiratory acidosis. That essentially means that carbon dioxide builds up in the body and can't get out because the lungs aren't able to push out enough of the liquid. So it does have to be used in conjunction with a positive pressure ventilator to help cycle it at the right rates. This is the main thing that's preventing it from widespread usage, the other thing being FDA approval. The FDA accepts that liquid ventilation is a safe method, but it doesn't believe that it's any more effective than methods we have right now. So this hasn't been fast-tracked, though it is being developed for several uses. That's all here. I hope you've enjoyed learning some more about PFCs. Thank you.